Welcome back to StartUpHealth TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm your host, Logan Plaster, with my guest here, Drew Mercer, CEO and co-founder at PayGround. Drew, always good to see you.
Likewise, Logan. Thanks for having me again.
So, it's been great watching your journey. You guys have been really gaining momentum, growing quickly. Explain to me about this work that you're doing in the digital payment space of healthcare.
Yeah, so PayGround, for those that don't know, we're a healthcare payment platform really building a solution that brings multiple audiences together. So patients, providers, payors, and really focusing on transacting payments more securely and conveniently. Okay. So what's unique about us, because there's a lot of payment options out there in the market, is we delivered healthcare its first digital wallet. Okay. And so from a patient perspective, you can go to the iOS or Android app stores, download our app, and pay any medical bill through it. If your provider's on our network, you're automatically going to get your balance in there, and you can one-tap pay. If your provider's not on our network, you're able to just take a picture of that bill, and then we mail a check to that provider. But really, our go-to-market has been around getting as many clinics and hospitals on our platform, and we become really that cloud-based payment tool for them to collect payments from their patients.
How has that go-to-market gone? How have people responded, and how have you grown recently?
Yeah, I mean, it's for us going and launching in January 2020. We're a COVID-era startup, like many are.
Exciting time
here
to start a
at
business.
HLTH. So we really had to focus on a digital means to bring in clinics at first. We started out in the ambulatory space, and that's where we really built our traction. And then through success and proven our value out to clinics, we've been fortunate enough now to grow into the hospital and health system space. And so we transacted our very first hospital transaction in January of this year.
Congratulations.
At Integris Health in Oklahoma, and we haven't looked back. So we're bringing on, as we speak, the largest post-acute provider in the country, Select Medical.
Talk to us about the difference between that hospital client and the clinics in terms of complexity and why that's such a big deal.
Yeah, once you have the bones of a good payment solution, the question then becomes, how do you make that tool to become interoperable to where you can bring in multiple sources of data regardless of PM or EHR system at scale and make it secure. And so by having those proof points in the ambulatory setting, the question then became, how do we get Epic and Cerner and others on board? And so that's been our story so far in 2023 is Epic and getting that solution integrated.
Okay. Educate us a little bit here about why this is so complex. Everyone is used to paying digitally for everything now.
That's right.
And so why can't you just go through your typical workflow in the hospital and then at the very end do Apple Pay, do your typical whatever? What makes it so difficult?
Yeah, it's because healthcare is siloed. And over the course of the last handful of years, I think us as a healthcare community has done a lot better job of sharing clinical information, but we still are really bad at sharing financial information on the revenue cycle side. And so that's where we saw the gap. As you know, the origin story of PayGround is my family went through a couple big medical events, and we were inundated with medical bills. We received over 20 in a short amount of time, and an emotional time. And we just wanted that Apple Pay experience that you're talking about. And it's not so easy because of the siloed nature of healthcare.
It's even telling that I would even say Apple Pay because I could have said 7 other options.
That's right. Back then I said Zelle and Venmo.
Exactly, and that one just popped up.
Right.
Now I like the fact that I can use my finger on my MacBook Pro to pay with Apple Pay.
That's right.
So it just keeps moving and moving and moving, and that's just sort of a symbol of where we're going.
That's right.
Could you give me a sort of a macro lesson in where the healthcare landscape is in terms of accepting digital payments? Is it heating up? Are there a lot of players in the market? Where are we at right now?
Yeah, I would say it's heating up. I think the consumer nature of patient engagement, these focuses that these providers have, large and small, isn't going away. It's been on our doorstep now for a couple years, and so I'd say we've got a opportunity at PayGround to really capitalize on that. And so when we go in and we compete against some great solutions out there, I don't think there's a shortage of payment options in healthcare. But what makes us unique is really being able to go to direct to consumer, to individuals and families, and say, hey, you can manage all of your payments in the PayGround mobile app, and can receipts, be alerted of any outstanding balance from providers. And if that provider, like I said earlier, isn't in our network, That's all good. You just take a picture of it, tap with your digital wallet, HSA card, any debit, credit card, bank, and we'll take care of that for you.
That's exciting.
Yeah.
I know you birthed the company out of Arizona, correct?
That's right. State 48.
That's right. Is your go-to-market, is it kind of hub and spoking out of Arizona, or are you going just all national? What's the deal?
We are national. We're in all 50 states. We've been able to
congratulations.
have that little party just not too long ago.
Okay.
And but early days, yeah, we were, especially in that COVID era, our first 40 customers were Arizona-based companies.
Okay.
So it's our backyard. We've got a lot of love for our home state.
Yeah, and you sort of tested it out with clinics that you could go and see in person. And so what does that next phase look like in terms of growth? You say you're moving into hospitals, bigger organizations. Where would you like to be in a year?
So I would like to be in the team understands we're at our scale year here from mid-2023 into mid-2024.
Because you've raised some funds, haven't you?
That's right, yeah. So we're excited about very soon closing on a Series A.
Congratulations.
And thank you. It's, raising money is startup community here knows it's not the best time to raise money, but I think too, I hate to keep on saying COVID era startup, but I think that has built within our mentality being survivors and being able to handle adversity. And so when we do come across a tough season, we survived COVID, we can survive anything. Yeah. And so we are thankful to say here very shortly in the next couple of weeks to close an oversubscribed Series A.
That is fantastic.
Yeah, and scale into the next season.
You deserve a special badge for closing a Series A in this market right now. Yeah. And it's going to be an exciting year to see what you do with that.
Thank you.
What's one thing that we haven't talked about yet that you're excited to be able to do leveraging that raise?
Yes. So first phase at PayGround was building a very convenient payment tool that consumers, patients can pay with ease and security. Second phase is about optionality, being able to pay multiple ways, no interest payment plans, and patient financing.
Got it.
We're doing that now. And then the next phase, to answer your question, is all around price transparency and advocacy. So that's something that we really are looking to use these funds to go and execute.
Interesting. I just talked to somebody that was all about price transparency. How would you use your platform to go upstream towards that goal?
Yeah, so it's all around the No Surprises Act and the legislation that's coming out from Washington, and providing patients the price estimate up front of what a procedure would cost, but not only the education of what it would cost, but allowing the provider to go ahead and collect a portion of that, if not the totality of the amount, and that just makes for a very clean revenue cycle. So we believe we can get pre-visit collections way beefed up.
Interesting. That sounds like that's going to become a real differentiator, because there's going to be some folks that just want to do payment processing.
Yeah.
So if you are, say, I'm a healthcare company, I'm going to move upstream and understand the No Surprises Act.
Yes.
That really changes your whole category.
That's right. We believe in that.
Yeah.
So it was well said.
Awesome. Well, Drew, I love getting these updates. Thank you for coming by the studio. I'm going to be looking for that news about the closing the round.
Yes.
Maybe by the time this goes out, we'll be able to tag that in the video.
Okay.
And then we'll be watching you closely over the next year to see how you scale up.
It's always good chatting, Logan. Thank you so much.
Thanks, Drew.